There's some shots that we inject into the eye. What are those shots as far as diabetic retinopathy goes?
So the main one is like, again, it's a similar for macular degeneration where we get swelling of the retina for a different reason. So the what's called an anti-VEGF injections can actually reduce swelling of the retina. So it can be very effective in the treatment of the diabetic macular edema.
So there's a hormone vascular epithelial growth factor that causes problems, and you can inject those growth factors.
Yes,
is that right?
That's exactly right.
And that keeps the eye from dying. Do you see that commonly?
We see it all the time.
That's pretty scary.
This is almost like an epidemic. I mean, we see, I don't know how many diabetics I see a day. I see a bunch. The retina doctors who do a lot of the injections stay busy all day long doing injections for diabetes as well as the macular degeneration. So it is something that we see far too often, especially for something that's controllable. I think that's one of the messages we need to get across is that this is controllable. And the other thing, what's going on in the eyes with the with the little blood vessels in the eyes? Well, the same kind of thing is going on in the kidneys.
Yeah.
Going on in the peripheral vascular system is why people, diabetics end up losing their feet, end up on dialysis. And so diabetes can be just a terribly wicked disease if it's not taken care of.
So if you inject the eye, let me go back. If you get hemorrhage into the eye, if those blood vessels fill the eyeball with blood, that just scares me to death to think about it. What do you do for that? And what danger does that cause?
So that by itself is not necessarily bad. I mean, the blood will either clear or most likely, if someone comes in and has a sudden loss of vision and they come and see me and I see that they have an eye filled up with blood, I will send those patients over to the retina doctors. And most likely, a diabetic in that situation will end up having to go to the operating room where a retina specialist will take out the blood back there and do all those little laser shots we were talking about right during surgery.
So every problem that we've talked about with diabetes that can eventually cause blindness, there is an effective treatment for it. But before it starts, it's in the hands of the owner who owns the eyes that says, get your blood sugar under control.
Exactly.
Be sure that you exercise, be sure you know what your blood sugar is, be sure that you keep it in a normal level. And that can be done. People can get their blood sugars normal if they work out the program with their doctor.